morning, everyone, and welcome. I'm Sang-Mi Oh, Vice President, Community Impact, Diversity, and Inclusion for the American Heart Association. I'm excited to have you join us today, and I want to thank Swinerton for presenting this engaging panel discussion on the need to inspire a culture of well-being and improve the health in our community. I want to take a minute to highlight the work the American Heart Association can accomplish and continue when companies and communities come together. Swinerton is our presenting sponsor for the San Diego Heart and Stroke Walk, but there's so much more than that. They're showing their commitment and investment in San Diego employees and communities by coming alongside us to tackle big issues. Every person deserves the opportunity for a full, healthy life. As champions for health equity by 2024, the American Heart Association will advance cardiovascular health for all, including identifying and removing barriers to healthcare access and quality. Here in San Diego, this means protecting our youth from big tobacco by working with local and regional governments to help pass policies that hold retailers accountable, not kids. This means working with companies like Swinerton to tackle the health disparities in the construction industry head on by bringing blood pressure screening directly into the office and onto the job site. It means working with federally qualified health centers to help their patients, often in under-resourced communities, to take control of their blood pressure by bringing much needed resources to these clinics. This means working alongside community groups to improve access to healthy foods and even further nutrition security for all through clinic, schools, and community initiatives. There is still much work to do, and we're glad that you have taken the time to join us this morning. It is now my pleasure to introduce Mark Payne, Vice President and Division Manager at Swinerton Builders here in San Diego, and this year's San Diego Heart and Stroke Walk Chair and a catalyst for change. Mark?
Thank you, Sang-Mi. I am honored and excited to chair this year's San Diego Heart and Stroke Walk and be a catalyst for change here at Swinerton and throughout San Diego. This will be the second year that I have agreed to chair the Heart and Stroke Walk, and I couldn't be more honored to be a part of such a great event and a great mission. As Sang-Mi mentioned, there are several health disparities that affect the construction industry. Compared to the national average, we see higher rates of blood pressure, smoking, diabetes, and even mental health issues. As the leader of our team, I wanted to take a stand to enable our members to take control of their health and start to change these trends. I want to first thank the executive leaders who have joined me in our fight against heart disease. And I'd like to notice them right now, starting with Tim Berry from Balfour Beatty, Robert Bossplug from Helix Electric, Kevin Cochran, Maine Electric, Brian Cox with Brian Cox Mechanical, Channy Dowd, Dyne Electric, Alex Hernandez from Costco Fire Protection, Bill Cunert with BKM Office Works, Robert McMillan, Berg Electric, and Dan Torpy with Qualcomm. This group of executives is working hard to build a healthier San Diego. The 10 of us have committed to making a significant impact by raising critical funds that will support this mission. Our goal is to raise over $1.2 million during this campaign. Today, we will engage in an important conversation about how each of us can make a difference in our own health, in our employees' well-being, as well as ways to ensure a healthier future for all San Diegans. You will hear from our panelists about how they are inspiring a culture of well-being and improving health in our community. And most importantly, you will hear how you can join this American Heart Association family to be a relentless force for longer, healthier lives. With that, It is my pleasure to introduce you to our moderator this morning, Dr. Ramon Hernandez. Dr. Hernandez is the Section Chief of Community Health at the UC San Diego School of Medicine and a member of the American Heart Association San Diego Division Board of Directors. Dr. Hernandez, thank you for leading our panel discussion today, and take it away.
Thank you, Mark. Good morning, everyone. I am thrilled to be with everyone today and participate in this important dialogue with you all. I have the pleasure of being a member of the Board of Directors for the American Heart Association in San Diego. I joined the AHA because I and my family have a long history of high blood pressure. My brother is also a stroke survivor. The mission of the American Heart Association to be a relentless force for a world of longer and healthier lives resonates deeply with me, and I am proud to be part of its work. I have met some amazing heart champions and heard so many compelling and inspiring stories that the drive to the work that we do as a leadership team inspires a healthier community for all. I'd like now to introduce our panelists for today. We have prepared a few questions for each panelist, and if we have time at the end, we will open up for questions to all of those who have joined us this morning. If you do have any questions, please type your question into the chat box. First, we have Chris Howard, President and CEO of Sharp Healthcare. Chris oversees a workforce of more than 18,000 employees, 2,700 affiliated physicians, and 1,800 volunteers. Sharp provides care and services in a fully integrated, non-for-profit system that includes 4 acute care hospitals, 3 specialty hospitals, 3 affiliated medical groups, 6 urgent care centers, 3 skilled nursing facilities, home health, hospice, state-of-the-art outpatient facilities, and a health plan. Up next, Dave Callis, President and COO of Swinerton. In this role, Dave provides leadership to all of the company's construction operations to ensure strategic alignment, collaboration, and continuous improvement of project execution. He brings strong industry experience and an innovating perspective to the management of business processes, the execution of work, and the development of strong and adaptable teams. In addition, as a member of the company's executive committee, Dave is an integral part of many collaborative and corporate initiatives, special projects, and developing and maintaining successful business partner relationships. Rounding third is James Floros, President and CEO of the Jacobs and Cushman San Diego Food Bank. The San Diego Food Bank and its North County chapter comprise the largest hunger relief organization in San Diego County. During the COVID-19 crisis, Jim was quick to mobilize and engage the food. During the COVID-19 crisis, Jim was quick to mobilize and engage the food bank and address the immediate need. Before the COVID-19 pandemic impacted our community, the food bank provided food assistance to 350,000 people per month, about 11% of the county's population. Finally, Mitch Mitchell, Vice President, State Governmental Affairs and External Affairs. Mitchell oversees external affairs activities for SDG&E. With over 4,000 employees, SDG&E provides energy service to 3.6 million people through 1.4 million electric meters and 873,000 natural gas meters in San Diego and Southern Orange counties, with the service area which spans 4,100 square miles. This is quite an impressive lineup. Thank you all for being here. We have some great questions for all of you, so let us begin. First, I'd like to start with a question that I would like to address to all the panelists, and we'll start with Chris. As leaders in our respective fields, the well-being of our employees and the community are top of mind. What does the well-being mean to your organization? and how do you define it? Chris.
Well, thank you. And it's a great question, all in all. You know, for our organization, it really means maintaining or doing all we can to maintain proper mental, physical well-being, being there to support one another, which we do. We work so hard at Sharp, and we all do at all of our organizations. I realize that. But by taking care of one another, really stretching out to understand what it means within our employees' work life, within their home life, to whatever degree is necessary, and they share and want us to provide support for their personal lives. There's a cross continuum of a host of dynamics that we try to address for our employees, but all of that is with one thing in mind. And the one thing in mind for Sharp is how we deliver the Sharp experience. And at Sharp, we try to deliver the Sharp experience by ensuring that we're the best place to work, the best place to practice medicine, and the best place to receive care. If you're going to be the best place to work, we really have to understand what it means to be within the psyche and the emotional, physical well-being for each of our employees. And so we strive to do that each and every day.
Thank you, Chris. Dave?
Yeah, good morning. It's great to be here today. And for us in the construction industry, as you can imagine, it is a very stressful, high-paced industry. And so for me, well-being of our organization really looks like a healthy work-life balance. It's a really important thing for us, particularly as an employee-owned company. It's critical to me that our employees feel comfortable establishing that balance, and that conversation about work-life balance is at the forefront of all discussions, particularly over this last year with COVID. It's been a tough year. And, it's like all of us at the beginning of the pandemic, you're stressed out about what's going to happen, the unknown of what's happening. So really just making everybody feel comfortable with work-life balance. And that means a different thing for all our employees. And we found over the years that it really starts with leadership, whether that's Mark Payne as a division manager, a department head, but exhibiting a strong work-life balance and feeling comfortable to at 2 o'clock to drag up and feel confident that you can walk out the front door and go to one of your kids' baseball games or football games or whatever activity that you feel is important, and not be shy about that. We think that creates a healthy organization and a place that people are willing to work hard and play hard. So that work-life balance is important for us.
Thank you so much, Dave. And now I'd like to go to James, please. Thank you.
Try to approach this maybe a little bit of a different angle. The way you define well-being is culture. Creating an organization steeped in culture. We've all heard that, and that's important for any business or organization. But for a nonprofit, it takes a different level. It's a next level up, because you really want to hire people who are working at the nonprofit because they want to make a difference in the community. It's long hours, it's stress, it's lower pay, but you surround yourself with a group of people who are committed to a single cause. And that culture creates this sense of being, the sense of mattering, sense of being a part of something bigger than themselves, service before self. And so really, the culture that we've built here at the food bank is people who are committed to the cause. And that really showed itself during the pandemic. We're not stay at home. 95% of our staff are on the ground day in and day out. From day one from the pandemic, there are people that maybe could have even been vulnerable, part of a vulnerable population. But when they were asked, are you comfortable being here? They said to a person, no, I'm here to feed people. Let's go feed people. So there was that culture between our staff and volunteers really has helped lead the food bank in our efforts from feeding 350,000 people to 600,000 people enough. So I think the well-being for our employees is they have a pride of working for the food bank. There's almost a swagger, and they're very proud of the efforts that they have put forth and really helping lead the community through the pandemic.
Thank you, James. And then Mitch?
It's when you talk about the well-being of employees, 2020 was really the great challenge for business all over the country and all over the world. And well-being, and had to start with what's your culture. And our culture at SDG&E has taught us that we needed to check in with people and make sure that they were adjusting to this new phase of their lives. We had people working nonstop from the moment the rest of the world shut down till today, because we had to keep the power on and the gas flowing. It's funny because I'm on with two panelists. We had a lot of interaction with Jim at the food bank, because one of the things that we talked about was food insecurity. With people seeing reduced hours, our culture told us, don't just go step back and try and stay healthy yourselves, but step out and try and help those who are truly struggling. You know, we had many instances where we were dealing with Chris Howard in the hospital. We had to make sure that they always had the power flowing because of the flood of patients, unfortunately, that were coming in due to COVID. And what we saw as far as the well-being of our employees, where they were happy to be providing an essential service, but they were even happier that we were checking in on them and their own personal well-being, because it was interesting. I have 82 people that work for me, and a lot of them with young kids. The balance of trying to get your job done and be teacher, lunchroom person, recess attendant at all was really a struggle. But your culture tells you everything. And I'll say one other thing. Last year in May, we saw a horrific event of the murder of a person on TV, and that also created a need for us to check in on our people, on our employees. And that's what a good culture is we wanted to make sure that they were psychologically safe and healthy and getting through all the challenges. And 2020 was definitely the year of challenge, but I think the business community across San Diego did a great job of stepping up and really embracing the opportunity to check in on their people and create the right culture and the right environment.
Thank you so much, Mitch. And thanks everyone. Thank you all. I just want to take a moment to thank you all and all the work that you're all doing for the well-being, not just of your employees, but for all our communities across San Diego. This has definitely been a difficult year, and I just want to take a moment to thank you for all the work that you're doing. So now I'd like to go to a question for Chris. We know the past year has been challenging for essential workers like medical staff, administrators, and support staff. How is SHARP addressing the needs of a diverse community like San Diego while managing the stress, anxiety, isolation, or fear amongst its teams?
Well, that's another great question, and you know, it's bigger than probably all of us, right? I mean, because we're one part of the equation of how we have taken care of San Diego this past year. And really, you think about that, and we've all pulled together, but to make that possible. But when I think about it in terms of how we've taken care of San Diego and the unique needs of our community, as opposed to how we've taken care of our employees, well, for the community itself, you know, we're the largest healthcare provider in the region, and as such, we're fortunate to have locations literally all across San Diego, including, fortunately in this case, all of those really, that were the hardest hit by COVID-19. And I can't say enough of how proud I am of our care teams and how they stepped up through incredible stress to find ways, creative ways, much of the time, to take care of those who were in need this past year. We had more COVID positive patients rolling through SHARP facilities than any other provider over the past 14 months. And we did so, I think, in large part because, to your question, we really tried to ensure we had resources and assets where the need was greatest. Our medical group sites opened outdoor respiratory clinics across the community, and they adapted coverage as best they could by opening new locations. Sometimes they closed locations, but they opened hours. They extended all care services as best they could to ensure that all of our coverage on an ambulatory remote basis was covered. Our health plan adapted its coverage to ensure that those were served, those who needed it most were served. And our hospitals, they really did a great job of coming together. We have 7 hospitals in San Diego. Throughout this pandemic, they acted as one. They truly shared resources, staff, did everything they could to ensure that no individual within our community, no matter where they were located, went without the care that they needed. And that was sometimes easier said than done throughout this pandemic, especially as we got to the largest crush in January, which was, I know, a scary time for us all. And then, you know, moving forward, now we're fortunate to be playing this role of helping to end the pandemic by operating 5 community vaccination sites all across San Diego County. We have a super site at Chula Vista, a super site at East County, a super site up in San Marcos, and then we have 2 smaller sites in Kearny Mesa and Coronado. So putting all that together and truly listening to our community is really how we emphasize how we would care for the community during this. But, you know, how we cared for our own Sharp family, much in the same theme. We started by asking our Sharp family, what did they need most from us? And I think you all heard the stories loud and clear through the early part of the pandemic that, you know, our employees were scared just like everybody else, always worried. Not worried about taking care of patients and saving lives with medical technology and protocol, but staying safe from the virus. And so first and foremost, straight up front, we spent most of our energy working to ensure we had adequate personal protective equipment. And that was no easy task because it was in short supply. And, you know, we couldn't always say we had enough to cover every single individual at every single hour or minute. And that scared us. So we focused most of our energy on ensuring that we had that. And we did, fortunately. But as time rolled on, it was really to the point a lot of us will make, the emotional, physical stress of the pandemic that really struck our employees. I saw them wear down month over month. You know, at the first of it, you're in the euphoric stage of we're going to fight this, we're going to beat it, we're going to knock it down, and the entire nation recognizes what you're doing. But 8 months later, people were tired of it. Staff were tired of it. And all they saw during the fall and early winter season was this crush. And so we spent time providing support, emotional, physical, well-being, financial support for our staff. We had a Care for the Caregivers emotional support program. We provided extra time off for our employees that needed to be with either their family or their children who were now home from school, or even elders who were no longer had access to elder care. So by listening to our staff, we've truly just tried to put the resources where they were needed most. And now as we kind of branch into whatever the new normal is going to be, we're listening once again, both to our community and to our staff, saying, what is it that now you need most today? And you know what? We all need to get back to that new normal, but we need emotional, physical, and sometimes financial support. So Sharp is reaching out both across our community and then within our own team member base to try to do everything we can to provide the best of all of that.
Thank you so much, Chris. I'd like to go to Dave on this question and go back to part of what you shared in your introduction. We know that the construction industry is disproportionately affected by high blood pressure, diabetes, and higher rates of tobacco use compared to the overall national average. That, combined with the physical demands of the job, puts trade workers at higher risk of heart disease and stroke. How does Swinerton encourage its teams to prioritize health on the job site, in the office, and at home?
Yeah, that's a great question. And as an industry, we've certainly evolved like everyone else. I remember when I first graduated from college and started in the trade or in the industry, I'd walk into our trailer and it was a smoke-filled catastrophe. It was terrible. We've come a long way since then. But it's important to recognize that at Swinerton, about 50% of our 5,000 employees are professional administrative folks, you know, estimators, project managers, engineers, accountants, and 50% are craft and tradesmen. So guys actually out there working in the field. And up until a couple of years ago, the majority of our health and welfare programs were really focused on our administrative staff. And we did a really fine job with that group of population. But in my opinion, we've woefully neglected our craft employees in this regard. And it's not uncommon in the industry. The tradesmen, generally speaking, are transient in nature in the sense of you'll oftentimes see them hold a higher allegiance to their trade union than their employer. So I'm a carpenter, and they'll call themselves a carpenter, and they've been a carpenter for 20 years. And in that 20 years, they work for a different contractor 3 or 4 times a year. And so you can get your head wrapped around how they get there. So a couple of years ago, we decided to go on a mission and we pledged to ourselves as an organization that we are going to become the #1 employer of craft in the industry and change what a craft worker looks like in the construction industry. So to do that, we built a new department and platform to execute this mission, and we called it Craft Services. And our Craft Services department's sole mission and responsibility is to improve the health and well-being and employee experience of our craft population. And over the last couple of years, some of the programs they've rolled out are, for example, appropriate bilingual onboarding. So first day of employment, we'll spend an hour and just explain all the benefits we have to our employees, whether that's their vacation pay, sick pay, their supplemental sick pay for COVID, their health and welfare programs. And then on top of that, we'll send home a mailer to their houses so that their family members understand the same benefits. And that kind of seems benign, but what we found was when we'd onboard our employees in the past, in the rush to get to work, they'd sign their paperwork, they'd rush out to the job site, they would take their benefit package, throw it in their glove box, and never got home. No one really understood it. So that became particularly important during COVID over the last year, because we rolled out a number of programs focused on particularly the families of our craft workers. And some of the programs, back in September, when we realized that kids weren't going to be able to go back to school, we rolled out a technology loan program to allow our craft employees to get internet service by Wi-Fi, by tablets for their children. We gave them free cares.com memberships, and free.com gave them child care services. It gave them free tutoring and other home services supports. This sounds kind of crazy too, but we gave them free Uber Eat accounts so that they didn't have to go out to the grocery store, that they could order food in for their families. And we're currently on this vaccine education. We found there's a pretty strong vaccine hesitancy within our craft population. So we rolled out a communication just informing our craft what does vaccines mean to try to increase vaccination within that population. We've also learned that the majority of our injuries on the job sites have been soft tissue injuries, back, shoulders. So we launched a daily flexion stretch for all our craft employees. So you go to job sites in the morning, and you'll see 100 guys doing stretch and flexes on our job sites. So it's pretty cool to see. But we've just started this journey, and we feel like this health and welfare program has alleviated significant stress and anxiety, particularly on the home front with the families, and are confident that isn't going to improve both the health and reduce harsh risk of all those employees and their families. So it's a journey that we haven't completed, but it's something that we're really passionate about, is, again, being that #1 employee of craft in the industry and keeping them safe.
Thank you, Dave. I just want to take a moment here and just do a quick reflection on both, the work that you're doing, and then also Chris with Sharp. And, this has just been such an incredibly stressful year for all of us and for our communities in particular. And just the work that you're doing to really work on these issues of stress and anxiety and connecting your employees to health and wellness, and really thinking so incredibly innovatively of different ways to get them services and resources that they need, so for their families and also for their communities. So I just wanted to, I'm probably going to say thank you a few times today, but just really want to say again, thank you for the work that you're both doing across San Diego and for all the communities that you're serving. So thank you. So now I'd like to go to James and also talk a little bit more about our community and the San Diego Food Bank. The food bank has been one of the most integral pieces of community support through the pandemic. What do you see as the most urgent needs in our community right now and in the next year?
That's a great question. It's a really big question. I only have a few minutes to answer it. I could give you probably an hour. Food insecurity is actually pre-pandemic one of the greatest challenges our community and our nation faces. And a lot of people don't really realize what that impact has on society. Pre-COVID in San Diego County, we estimated about 1 in 7 people, about 450,000 people were termed food insecure. It's working poor, seniors on a fixed income, children living in poverty, believe it or not, active duty military. Then COVID hit, and that number pretty much doubled. There's probably close to 1 million people in San Diego County that are food insecure, and for the first time, they're needing help. They're going to food lines and trying to feed their family, and it's just been had a devastating effect. And a lot of them are a little reluctant to seek that help. Food insecurity is, again, one of the greatest challenges, and some of the people on this panel know it better than any. Lack of food, lack of nutritious food has horrific consequences to our society. Lack of nutritious food leads to poor health outcomes. So rampant obesity, diabetes, heart disease, hypertension, mental health issues. And so you have a whole host of a population of people who are poor health outcomes, poor standard of health, directly related to a poor diet, which is directly related to poverty. And then you take the other side about academic outcomes. Children that aren't eating for school, they're not eating over the weekend. When their families do feed them, they're feeding them unhealthy food. So the chances of them having a strong academic outcome become greatly diminished. Chances of them graduating from high school greatly diminished. Chances of them getting a job where they can support their family greatly diminished. This is the cycle of poverty that the food bank is focused on. This is the centerpiece of all that we do. If there is one silver lining from the COVID crisis, is that the nation's spotlight has been on food banks. I've seen articles that have said food banks are literally leading the nation through the pandemic. And it's hard to say that there's a silver lining from the pandemic, but now we're seeing a lot of support. We have way more donors than we had before the pandemic. The government is finally really stepping up and supporting food banks across the nation to provide food assistance to people in need. And our hope and our goal and our message to elected officials, I've been making all the rounds with the state and federal officials, is that for the first time, we see the U.S. government and the community really realizing how food insecurity is one of our greatest challenges. They're providing that tremendous level of support. And then, you know what, hopefully post-pandemic, that support continues on. And that is really, our hope and our message. And what do we see in the foreseeable future? Well, when, food insecurity was a problem before COVID. Food insecurity is a big problem during COVID. Food insecurity has made a big problem after COVID. And our hope is that the community and the government will continue to support food banks and their efforts to feed people. And then we're gonna pivot from COVID to recession, and we're gonna see increased lines for the next 2 to 3 years. So we knew from the very beginning, this was not gonna be a sprint. This was gonna be a marathon. And we got a long road ahead of us.
Thank you, James. And, as a board member here for the AHA in San Diego, I'm just really happy, that we're here to support you and the work that you're doing, and that nutrition and good diet in particular is one of our core areas, and how to make sure that our youth and our children, particularly in the school systems, have access to healthy food and good food to help with their academics and to help them thrive. And so thank you for all the work that you and your team and your organization is doing to really address food insecurity and move towards food equity and security across San Diego.
We really appreciate that. And a tip of the hat to Sharp helping get all of our employees vaccinated.
Yeah.
Chris, thank you so much. That was a big win for us.
Welcome. Happy to help.
Thank you. So Mitch, let's, with SDG and E's view into the community, how are you addressing equity in the communities that you all serve?
It's a great question, Dr. Hernandez. And one of the things that happened when COVID first occurred and the shutdown began, we made a quick decision to work with the Extended Foundation. We were the first company to walk in the door and say, we'll put $1 million to start the fund. And we did that because we knew there was going to be a domino effect due to the COVID implications. And aside from the stress levels of everyone worrying about their own health and safety and that of their families, we also knew that the work that Jim was doing at the food bank was going to increase because a number of people were laid off immediately. It's hard to believe that there are people who've been laid off since February, March of last year in the tourism sector. And so we focused a lot on food insecurity and trying to provide additional resources to the food bank to feed people. We also became creative. We know that the nonprofit sector of San Diego provides so much support for the region that doesn't get noticed every day, but is essential. And I spent a lot of time with Chris because I'm on the Sharp board, and I would listen to the wear and tear on the employees there and how they were trying to get through this all. But we realized that there were things that we should be doing to try and have our structure adjust. And what I mean by that is we spent a lot of time, my team, with the nonprofits that we normally fund, trying to teach them how to pivot so that they could still provide essential services. We didn't want any community in the San Diego region or South Orange County region to go without. And so we focused on things, like I said, food insecurity. We also focused on the digital divide. And I'll tell you a couple of great stories. One night I was on the phone with the superintendent of the school district, Cindy Martin, at 8:30, 9 o'clock at night with she and her senior team, because I know the importance of the backpack program that Jim provides every Friday to the kids that if without it wouldn't eat throughout the weekend. And I had reached out to Cindy to find out, what are you doing, what's happening, how can we help? And we had a long conversation about the struggle, because with schools closed, they couldn't feed all the kids that they normally feed. And for us, that was an equity issue. Right, we knew that it wasn't the communities that were upper income; it was the neighborhoods where the working families who were now seeing reduced hours were really going to see the impacts. And so we began focusing on also digital divide issues. We worked with everything from the state superintendent on education to the tribes, trying to figure out technology solutions, because a lot of people thought the digital divide had disappeared. But it was prevalent in many households where you had one device for 3 kids to use to try and to learn each and every day. And so we're very structured on our process to begin with focusing on certain areas around STEM and things of that nature. But during COVID, our main focus became, where can we fill the gap, or how can we help a nonprofit pivot so that they're still providing an essential resource, even though it's online now, not in person. But these are things that we knew would make a big difference. And when you're an energy utility, you wake up every day with one focus. Every household and every business needs to make sure that they're getting the same level of service, no matter what time of day, what day of the week, or what month it is. During COVID, it was even more essential that we be creative and more driven by the thought that the need was greater than ever, and that we had to be supportive, and it wasn't just about writing a check. It was about people rolling up their sleeves and trying to figure out ways to help. I was down at the Qualcomm food distribution every other Saturday for a couple of months, and it was heartbreaking at times to see the number of cars that were there. But I think our culture at SDG&E is that again, when things get tough, we step up, not step back. And I think that we all acknowledge that there are different neighborhoods. Life is different in all the neighborhoods in San Diego, and for us, equity became a real focus to make sure that the equity was the direction that we were pushing was really addressing the inequitable situations during COVID that was impacting everyone. So that was basically it.
Thank you so much, Mitch. I mean, your answer, as someone who works with high school students and community college students across the county, the digital divide has just been such a big issue during pandemic. And so thank you for all the work that SDG&E has been doing to help address that. And I think the other thing I just am reflecting on is just the collaborative nature amongst you all and amongst everyone during this pandemic, prior, during, and I know after, that this really is a community effort, and how we're all working together to get to this next point and help really create health equity and healthy lives for all our community members. So thank you to the 4 of you and to all your employees and all your teams who have been working on behalf of our communities during this time. So I have one question that I'd like to ask all of you. We've sort of been focusing on the teams and the community members. And so this question kind of puts it back to you as the leaders. And particularly as we know, stress is such an important factor in staying healthy and keeping our hearts healthy and controlling our blood pressure. What have you been personally doing to overcome the stress over this past year and to lead by example? So why don't we just go back in order and start with Chris?
Well, that's another great question. And boy, listen, this past year presented challenges just for me personally. And I think you have to be honest about that. If you're really going to be honest about what you're doing to address your own stress, you have to say, what stress am I feeling? I felt the same thing every other person on the face of the earth felt this last year. Unsure about what this virus meant, what it was bringing, unsure what the future would hold, how we were going to address all of these challenges that frankly we'd never seen before, I'd never seen before. And that took a toll from a stress perspective, emotionally and physically. I found myself, like a lot of others, cooped up in the house, eating in a lot or making unhealthy things, and, really focused on listening to the news and getting more stressed out. And I really learned that I had to do the same thing that we were trying to do for our employees, which was to ask myself, what was it I needed most? I needed emotional and physical well-being and balance. And so, like everybody else, I tried to find ways to do that, how to compartmentalize the news, take that emotional stress off the table. There wasn't much good to be reported on the news over the last 14 months, let's be honest. And even when vaccines were presented, it was all about, well, there won't be enough, or some aren't going to work or whatnot. So I really focused on compartmentalizing my own mental stress and propping it up and avoiding those things that stress me out more. I also took advantage of some of Sharp's resources and really spent time with our team members that were feeling the same, used them as a kind of a bounce off group, if you will, an emotional support group. And then honestly, I got out and I took on some physical exercise, more than I probably would have before, because every day I did that really made me feel better. So it's a work in progress. I'll tell you now, we all feel the stress of wanting to get back to our real lives and to help our families move on, because our families are feeling this too, right? It didn't stop with us. And so I think I'm moving to a better place because of having a more balanced life, but it's a work in progress and something that I think will be, even as we finish up now the rest of this year. But I'm in a much better spot and enjoying that exercise, and frankly, enjoying eating a little healthier, and definitely enjoying turning off that news on occasion.
Yeah.
Thank you, Chris. Dave?
Yeah, like Chris, I think every one of us, of course, experienced in the first 4 months of the pandemic, just the stress of the unknown. And as leaders of organization, kind of had to be the calm in the storm, and at least pretend like you weren't stressed out and provide that leadership. And then you turn off your Zoom call and be stressed out. So it was just the unknown was, I know we all probably got a little bit of gray hair this year. But like Chris, what I did was I just focused on, after I hung up that last Zoom call at 6 o'clock, I just made sure I got physical activity, just like Chris, you get out and you go for a run or you exercise. What was interesting, I think we probably all experienced this at the beginning of the pandemic, just all the snacking, you're sitting on Zoom calls for 12 hours a day and you'd run back to the refrigerator, grab something, run back to the refrigerator, have another call, go back to the refrigerator, like, holy crap, I'm eating a lot. So just getting back in a better cadence of working out. It's going to be exciting to be out of this pandemic. But again, just working out.
Thank you, Dave. James?
Well, I certainly feel like I have a kindred spirits on the panel. You cannot make, our motto is you can't make this stuff up. I mean, we were in the front lines, day one, long hours. I think I had 2 or 3 days off in the first 10 weeks, but that was the same way with all our staff. And, this has been the most challenging year of my 37-year nonprofit career, but also the most rewarding. A lot of camaraderie with the staff. We all bound together. But I could see, and even a lot of my senior staff, a lot younger than me, were all wearing down, and it was affecting our health, and we saw that. And so just trying to find outlets, and our HR department did a lot of things to kind of boost morale. We brought in lunch, at least once a week for all the staff, or a couple times a week, and some activities to just try to help lift their spirits and help them really feel how important and relevant they are. Time off, crucial. And not only did I have to force myself to take some time off, but also force staff, and I still am doing that, where they're saying, no, I got so much to do. I'm like, it'll be here when you get back. You need to take some time off. Some extracurricular activities, as Chris and Dave mentioned. I've always been a big gardener, kind of got back to my roots, no pun intended. Became a Home Depot juggernaut, and, worked a lot in my backyard, did that. Also, I would go for a morning walk with my wife. We call it a morning talk, 30 or 40 minutes. And she's my junior CEO, and she knows all the players. She knows all the acronyms. She'll, at the beginning of the walk, she'll say, she'll have an idea. I'm like, oh no, that's a horrible idea. End of the walk, I'm like, actually, that's a really good idea. I should probably do that. So my wife was a big part of, and she was laid off because of COVID. So she was there for me. That helped out a lot too. But we ain't out of this yet. So just trying to find a way to pace myself, and maybe a little time off wouldn't hurt. And then, when you guys figure this out, you let me know. Okay.
Thank you, James. Mitch?
COVID was an interesting challenge for me, for the people on the panel who know me. Before COVID hit, I was living the tale of three cities. I was always in Sacramento, LA, or San Diego. I flew 70 to 80 round trip flights a year on average over the last 8 or 9 years. I was on trains and planes and in my automobile. And so when COVID hit, it was a real life change. One of the things that was most significant is I remember the first couple of weeks when I didn't have to get up and be at the office. I had to be on a Zoom call. I was sleeping in, I wasn't waking up at 5 a.m. And I realized that my body was tired. And so I learned a lot. I would say probably the biggest thing that I learned during COVID that I've implemented is I do now get 8 hours of sleep a night. And I read a lot about it, about heart health and about what happens. And I think most people would say that as you get older, your risk for heart health gets a little higher. As a black male in a high-paced job, I knew that I was more at risk, and so I'm getting 8 hours sleep a night. I bought a Peloton, and I convinced a lot of people on my team to buy Pelotons, and so we have a number of people on my team of 80 people that now own Pelotons, and we were challenging each other, and I have about a 64-week streak going now for using the Peloton, and that became a part of my daily portion. I think what we all were challenged by is, was it was an excuse because we were told to stay in and you had to wear a mask and be safe. Walking my dog was a regular thing, getting outside. So between getting the sleep and the Peloton, walking my dog. And I think the single biggest thing that probably made a difference for my health was my wife. We stopped eating out because, we didn't know if we could, I told her we were laughing about this the other day that we'd order pizza, but the pizza would get there and she'd put it in the oven because at the beginning, and Chris knows this, we didn't know what we didn't know. Did you have to, put everything you brought home in the oven to kill any COVID implications that might be on the box? And we just found it was taking longer to eat. So it was just easier to make food at home. And my wife started making, we became pescatarian, vegetarian, and we eat early. I mean, I think that was probably the single biggest thing is, being finished with meals before 6:30, before 6 often, made a big difference. And I think that what I would tell my team all the time is the mental stress that you weren't necessarily talking about was wearing you down. And if you weren't trying to counter that with some physical stress and some physical release, that was a problem. And I think Chris hit the nail on the head too. And he said, I made a decision to not watch the news all day, right? It's easy to have CNN on all day and listening to, to Wolf Blitzer say, breaking news, more vaccination problems, or breaking news, a sharp increase in infections. I would get a weekly briefing from Chris about what was happening in the space, and I would read that. But I think that you forget that if you're watching that all day, that isn't helping your mental health. And there is a balance between your mental health and your mental balance, and then your physical health. And hopefully coming out of this, a lot of people learned that being healthier and how you carry yourself in your day is so important. and heart health will be impacted in a positive way if you're actually creating more balance. So.
Thank you so much, Mitch. I think that's such a great way to end our panel today. I just want to thank you all four of you, for your candid responses this morning. I want to thank you, Chris, Dave, James, and Mitch, for joining us today and sharing your expertise and advice with everyone who's joined us this morning. You are all strong leaders with voices in our community, leading the way in employee and community wellness. With our collective focus, I know that we will all continue to be a relentless force for longer, healthier lives. So at this time, I would like to introduce Dan Torpy, VP Real Estate and Facilities at Qualcomm, and this year's Executive with Heart Chair, to share more about the American Heart Association, how the American Heart Association is working to improve the health of those in underserved communities across San Diego. So Dan, take it away. Thank you.
Good morning, everyone. I'd like to take a moment to thank Dr. Hernandez for moderating our panel, and a big thank you to our wonderful panelists. That was just such great conversation. So thank you very much for your time and insight. My name is Dan Torpy. I'm excited to be this year's Executives with Heart Chair. I've been a volunteer with the American Heart Association for many years in many roles, including company leader, ELT member, chair of the board of directors, and now chair of the Executives with Heart campaign. This year, I could not be more excited about what we are setting out to accomplish with the Executives with Heart. Who are these amazing leaders? Our Executives with Heart are people like you, leaders from across the San Diego committed to making an impact for the American Heart Association. In fact, I'd like to recognize the 20 individuals that have already stepped up and said yes to raising funds to save lives here in San Diego. This year, we are putting our names, our personal investments, and our networks behind a campaign that will support the American Heart Association's mission and an Adopt a Clinic initiative. Our goal is to raise the funds necessary to provide at least 5 clinics here in San Diego County with blood pressure monitoring devices, technical support, and assistance. This support is critical for these federally qualified health centers in the marginalized parts of our county, and we need your help to reach our goal. So I have one question for you. Are you in? Will you join me and the 19 other Executives with Heart members to bring these resources to the clinics that need them? On your screen now, you will see a question. If you are interested in supporting the American Heart Association in the fight against heart disease, click yes now. I'm going to do that. When you click yes, you'll be joining our American Heart Association family. When you click yes, you'll be saving lives. When you click yes, one of the American Heart Association members will follow up with each of you to celebrate your commitment and also help you build an impact plan. Are you on the fence? Don't be. The American Heart Association team is pros. They can make your Executive with Heart's campaign fun, impactful, and turnkey. Did you not answer? That's okay too. We can follow up with you to understand how you'd like to be involved and help you out with that. This is great, everyone. Thank you for your answers, and thank you for your commitment to being an Executive with Heart. While we tally up the yeses in the room, I'd like to hand it back over to Mark Payne from Swinerton to close us out.
Sorry about that little technical difficulty there. Thank you very much, Dan. I love seeing all the commitments coming in, and I really want to say thank you to everybody. I know everyone who joined us today is feeling inspired with innovative ideas on how they can create a culture that prioritizes well-being and how they as leaders show up to support their employees when they need them. I would also like to encourage everyone to become involved with the American Heart Association, either through volunteer leadership opportunities or just having a conversation with the team to learn how they may be able to come alongside you to support your health and wellness initiatives at your company or the community outreach goals. At this time, I'm proud to announce that we had a numerous amount of people say yes to being an Executive with Heart. That is amazing, and thank you for your commitment to saving lives from San Diego's #1 and #5 killers, heart disease and stroke. The American Heart Association team will be following up with you to schedule those meetings. On behalf of the executive leadership team, our panelists, and the American Heart Association, thank you again to everybody for joining us today. I really appreciate it, and I'm glad you could join us.